Are you one of the millions that's missing out on the benefits of chiropractic adjustments? Hi, I'm Dr. Crockett, and this is Dr. Sanders with Zeal Integrated Health. And today we're going to talk about the benefits of the chiropractic adjustment. You know, a lot of people, they don't go to the chiropractor because they've heard, well, once you go, you have to always go, or, you know, they'll hurt you, things like that. And the science just isn't behind a lot of these things. And the fact is, it's a very powerful pain reliever. It is something that can help treat your acute pains and your chronic pains. Let's talk about just how it benefits, you know, people struggling with acute pain.
There's many forms of acute pain. Some people assume that chiropractors only deal with acute pain of the low back. However, we deal with acute pain of the upper back, the neck, elbows, hands, legs, pelvis. We deal with all sorts of pain in the human body, and it's a great start. Even if you start to feel a little different or a little bit off, that pain could develop worse. It's important to get taken care of right away.
You bet. The faster you get in, obviously, the easier it is to treat. But one of the focuses that chiropractors really like to do is they really look for the root cause of that pain. And a lot of times when you're seeking other healthcare's advice, you know, it's typically a muscle relaxer or maybe a pain reliever. You know, cover up that pain and let's see what happens. You know, really with our profession, we want to really investigate what is causing this issue and address that. It's a drug-free approach, right?
Right. Most drugs we see, they treat the symptoms. Like you said, a muscle relaxer will treat just the muscle.
And natural approaches, they lower the risk of just impacting the liver, the kidneys. All these drugs have to be cleared by the body, and there's risk with that. So, you know, there's benefits by taking a drug-free approach long term. So lower risk, right?
Absolutely. Even the common over-the-counter medicines have high risks for those organs, like you were saying.
Yeah.
Chiropractic bypasses those and allows your body to heal naturally and healthily.
You bet. So as far as, you know, when we look at the risk factors, like we even see pregnant women come in and get adjusted just because of the changing of the mechanics of the lower back as the pregnancy is evolving, more stress on that lower back.
Absolutely. Pregnant women and children as they're growing as well. Both of these groups of people also can't take very many medications. Therefore, chiropractic tends to help them greatly with their pain where other things cannot.
You bet. And then I would say the other, I think, big thing that we do is chronic degenerative, you know, this arthritic type of condition that isn't going to be something that maybe can be resolved, but it can be managed. And there's really two ways to manage it. One of them is a pain med, and then the other would be to try to get movement mobility back in those joints to try to increase the flexibility there and decrease the pain receptors activity.
Absolutely. These degeneration conditions of the body have a lot of inflammation involved, and chiropractic's really good at reducing that inflammation and swelling around those joints and helping them live better and feel better even with their condition.
You bet. I would say wear out versus rust out, right?
Right.
You know, you need to be getting movement in those joints. Super important when you've got arthritis. The movement is key.
Absolutely.
And so I hope this, you know, brings some awareness to chiropractic, and I would encourage you to check out our video on our first appointment, what to expect, and comment below and click the subscribe button and check out some of our other YouTube videos.